السلام عليكم ورحمة الله وبركاته. أعزائي طلبة المرحلة الأولى، اليوم محاضرتنا عن the front of the thigh. First, we will study the cutaneous nerves that supply the front or the anterior aspect of the thigh. These cutaneous nerves that supply the skin of the anterior part of the thigh, these are from lateral to medial. These are the lateral cutaneous nerve of the thigh. This nerve, which is a branch of the lumbar plexus, supplying the lateral aspect of the thigh. Intermediate cutaneous nerve of the thigh. These are the branches that supply the intermediate part of the front of the thigh. It is a branch from the femoral nerve. And the medial cutaneous nerve of the thigh, also it is a branch from the femoral nerve, cutaneous branch of femoral nerve supplying the medial aspect of the thigh. Another nerves near the beginning of the lower limb, these are the femoral branch of the genitofemoral nerve. Femoral branch of genitofemoral nerve. Genitofemoral nerve also it is a branch of the lumbar plexus. Its femoral branch will pass below the middle of the inguinal ligament. This is the inguinal ligament, below the middle of the inguinal ligament and supplying a small area in the just below the inguinal ligament. Another nerve that is called the ilioinguinal nerve. Ilioinguinal nerve, this nerve passes from the superficial inguinal ring of the inguinal canal to supply a small area of the skin below the medial end of the inguinal ligaments. Also, it supplies the root of the penis and the part of the scrotum, and in female it supplies the root of the clitoris and part of the labium majus. On the medial aspect also we have the branches from the anterior division of the obturator nerve supplying variable area on the medial aspect of the thigh. So these are the cutaneous nerves that supply the skin of the front of the thigh. We can enumerate them. So we have the lateral cutaneous nerve of the thigh, medial cutaneous nerve of the thigh, intermediate cutaneous nerve of the thigh, femoral branch of the genitofemoral nerve, ilioinguinal nerve, obturator nerve. These are branches of the anterior division because the obturator nerve have anterior and posterior division. And the patellar plexus. Patellar plexus. This is formed from branches from the medial, intermediate, and lateral cutaneous branches of the thigh and the branch from the saphenous nerve. These are in red color. This is in the red color. This is the area of the skin that is supplied by the lateral cutaneous nerve of the thigh. The area in blue color, these are the branches of the cutaneous branches of the femoral nerve. These are the intermediate and the medial cutaneous nerve of the thigh. And we have also a contribution from the saphenous nerve to the patellar plexus here. Patellar plexus, these are branches of nerve that supply the skin around the patella. Also, we have a contribution from the obturator nerve, anterior division of the obturator nerve that supply variable area on the medial aspect of the thigh. Now we come to the important subject, which is the superficial veins. When we remove the skin and the superficial fatty layer, we will find the superficial vein that run in the superficial fascia. Superficial vein in the superficial fascia, we have two important veins. These are great saphenous vein and another one is the small saphenous vein. They have a clinical importance يعني هي فد أهمية سريرية. why because we use these veins اللي هو هذا خصوصا الجريت سافينوس vein نستخدمه في عمليات الشرايين، تبديل الشرايين التاجية. The great saphenous vein, this vein it runs in the superficial fascia. It begins from the medial end of this dorsal venous arch. This is the dorsal venous arch of the foot. From its medial end, we have the beginning of the great saphenous vein. It will ascend up in front of the medial malleolus on the medial aspect of the leg, then posterior to the knee, and then on the medial aspect of the thigh until it reaches the saphenous opening to drain into the femoral vein. The small saphenous vein, it arises from the lateral end of the dorsal venous arch and it ascends up behind the lateral malleolus and then on the back of the leg until it reaches the area of the popliteal fossa where it pierces the deep fascia to drain into the popliteal vein. There is a connection, as we said, there is a connection in between the superficial and deep veins. يعني here we are constant يعني great saphenous vein وال small saphenous vein, they both of them are superficial. They يعني superficial veins. They are running in the superficial fascia. We have another set of veins يعني اكو عندنا فد مجموعة أخرى من الفينز اللي هي راح تكون accompanied with the arteries نسميها deep veins أو vena comitants. So there is a connection in between the superficial and the deep veins through يسموها perforating veins. هاي راح يسوون فد connection in between the superficial and deep set of veins. طبعا هذه superficial vein they have valves يعني اكو بيها فد صمامات يعني تضمن لنا انهم بمرور الدم باتجاه واحد هو باتجاه الاعلى باتجاه القلب. There is a connection in between the great and the small saphenous vein. هذه هي هنا بداية great saphenous vein from the dorsal venous arch of the foot. Then it will ascend up in front of the medial malleolus of the tibia. Here it is accompanied by the saphenous nerve. يعني شنو؟ يعني يكون great saphenous vein يعني it is accompanied with يعني يمشي وياه فد nerve اللي هو نسميه saphenous nerve. Then it will ascend up the lower limb until it reach the saphenous opening. هذا عندنا الفتحة اللي هي بالdeep fascia يسموها saphenous opening where it will drain into the femoral vein. هذه هي saphenous opening. This is an opening in the deep fascia. هيكون great saphenous vein. It will drain into the femoral vein at the lower end of this opening. طبعا هذا opening انه as we said it is an opening in the deep fascia. It is called saphenous opening and this opening is filled by a loose connective tissue يعني حتكون هي شكلها مثل الفنستريتد يعني مثل المثقبة. هاي الفتحة حتكون بها fenestration يعني ثقوب. لذلك نسمي يعني هذه الجزء المثقب اللي يغطي هذه الفتحة نسميه الكريبريفورم فاشيا. كريبريفورم فاشيا. What are the tributaries of the great saphenous vein? We have small veins that it will drain into the great saphenous vein before it drain into the femoral vein. يعني we have these small veins that will drain into the great saphenous veins. These are called superficial circumflex iliac vein and the superficial epigastric vein and the superficial external pudendal vein. These three veins it will drain into the great saphenous vein before its entrance into the femoral vein. هذه الصورة نشوف أنه توضح لنا ال dorsal venous arch of the foot from its medial end. بدأ عندنا هذا هو ال great saphenous vein ومن ال lateral end راح يصعد عندنا ال small saphenous vein. هذا هنا راح يكون ال great saphenous vein in front of the medial malleolus بينما ال lateral بينما small saphenous vein is behind the lateral malleolus. هنا ال great saphenous vein is accompanied with the saphenous nerve. هذا هو ال small saphenous vein on the posterior aspect of the leg. إنه كبداية من ال lateral end of the dorsal venous arch. It runs behind the lateral malleolus and then on the back of the leg until it reaches the region of the popliteal fossa. It will pierce the deep fascia to drain into the popliteal vein. Now we come to an important subject, which is the inguinal lymph node. Inguinal lymph node. طبعا هنا راح تكون عندنا أول شيء راح نشوف superficial inguinal lymph nodes. As we said, superficial, it means in the superficial fascia of the femoral area. Superficial inguinal lymph node ممكن أشوفها هنا دي متوزعة على خطين. خط هو اللي راح يكون parallel to the inguinal ligament، والخط الثاني راح يكون parallel to the great saphenous vein. راح تكون عندنا جروب، يعني جروب اللي هو horizontal وجروب اللي هو vertical. So we have a horizontal group parallel to the inguinal ligament and we have the vertical group parallel to the great saphenous vein. راح هذا الترتيب راح يسوينا في الشكل هو مثل شكل حرف T shape. هذه هي horizontal group as we said, horizontal group parallel to the inguinal ligament, and we have the vertical group parallel to the great saphenous vein. So it will form just like a T-shaped arrangement of the lymph node in the superficial fascia. What is important in the inguinal lymph node؟ المهم بالinguinal lymph node هو ال drainage of the lymph. drainage of the lymph. راح نشوف، راح نقسم الهوريزونتال جروب نقسمها إلى lateral جروب وميديال جروب، والفيرتيكال جروب هي فقط هي مجموعة واحدة. إذا هنا راح نكون هذه الهوريزونتال نقسمها إلى lateral جروب وميديال جروب. راح نشوف أنه كل جروب it will drain certain area. certain area it will drain certain. راح نشوف أنه الهوريزونتال جروب اللي هي الميديال members it will drain the anterior abdominal wall below the level of the umbilicus, perineum, urethra, external genitalia of both sexes but not the testis, lower half of the anal canal. يعني from this area the lymph will drain to the medial members of the horizontal group of superficial inguinal lymph nodes. Horizontal group اللي هي lateral members it will drain the back of the body below the level of the iliac crests. The vertical group it will receive most of the superficial lymph vessels of the lower limb. نشوف من هذه الصورة، هذه هي superficial inguinal lymph node، فشي يعني تخطيطي. راح نكون مثلا عندنا هنا خلينا نقول الميديال جروب وهنا هي اللاترال جروب. يكون الميديال جروب it will drain the anterior abdominal wall below the level of the umbilicus. Also it will drain lymph from the external genitalia except the testis from the perineum and the lower half of the anal canal. بينما عندنا اللاترال جروب هذا اتجاه السهم، هذا اللاترال جروب اجانا من from the back of the body below the level of the iliac crests. It will drain to the lateral member of the horizontal group. Next, if we remove the deep fascia يعني remove the skin, the superficial fascia with the lymph nodes and the superficial vein, then we remove the deep fascia, we will expose the deep inguinal lymph node. This, why we call it deep inguinal lymph node? Because they lie deep to the deep fascia. These are situated on the medial side of the femoral vein. This is the femoral vein, and these are the deep lymph nodes situated on the medial side of the femoral vein, and it will pass the its lymph vessel through the femoral canal to drain into the group inside the pelvis. These are the external iliac lymph nodes. These are the deep inguinal lymph nodes situated below or deep to the deep fascia on the medial aspect of the femoral vein, on the deep aspect of the femoral vein. If we study the superficial fascia and deep fascia, here the anterior abdominal wall, superficial fascia of the anterior abdominal wall. Superficial fascia is divided into two layers, superficial fatty layer and a deep membranous layer. Deep membranous layer. The fatty layer is continuous, and from that of the abdomen to that of the lower limb this is the same layer, fatty layer. But the deep membranous layer of the anterior abdominal wall, as it descends to the lower limb, just 1 finger breadth below the inguinal ligament, it will fuse with the deep fascia of the lower limb. هذه هي membranous layer of the anterior abdominal wall. As it descends to the lower limb, it will fuse with the fascia lata or the deep fascia of the lower limb, just 1 finger breadth below the inguinal ligament. This is the deep fascia of the thigh. We can see that the deep fascia of the thigh is just like a trouser leg، يعني مثل شكلها مثل البنطلون. Just like a trouser leg, it extends from the hip bone, it is attached to the hip bone and to the inguinal ligament. Here we can see that this is the fascia lata or the deep fascia of the thigh. It is attached to the inguinal ligament and attached to the bone, to the iliac bone. Here this is the opening in the deep fascia that is called saphenous opening for the passage of the great saphenous vein. There is a thickening of the deep fascia. على lateral aspect of the thigh, we have a thickening of the deep fascia that extends from the iliac tubercle down to the lateral condyle of the tibia. This thickening is called the iliotibial tract. Iliotibial tract, it will give insertion for the tensor fascia lata and for the major part of the gluteus maximus muscle. طبعا أنا عندي deep fascia, so it will split to enclose the gluteus maximus and to enclose the tensor fascia lata. What are the structure passing through the saphenous opening? هذه هي الأوبننج اللي قلنا in the deep fascia. There are certain structure passing through. واحدة من عندها اللي هسه شرحنا إنه هو الجريد saphenous vein passing through saphenous opening. مثل ما قاعد نشوف هاي small arteries also passing through. These are the small branches of the femoral artery to supplying nearby structures. And we have lymph vessels. Lymph vessels also passing through. And lymph vessel from the superficial inguinal lymph node will pass through this opening to drain into the deep inguinal lymph nodes. The deep fascia, this layer, will send a septa that will attach to the linea aspera. يعني راح ترسل فتح حواجز تتصل بالعظم اللي هو الفيمر من جهة اللينيا أسبرا، وراح تقسم لنا الثاي into compartments. راح تقسم عندنا anterior compartment, posterior compartment and medial compartment. الفائدة من عنده شنو؟ انه كل جروب راح تنعزل عندي، راح تكون عندي كل جروب it have its own muscle, its own nerve and its own blood supply. كل مجموعة راح تكون هي طبعا الفانكشن مالتها اعتيادي راح يكون باختلاف عن المجموعة الأخرى. راح ناخذ أول مجموعة هي Anterior Fascial Compartment of the Thigh. راح نشوف شنو المصل الموجودة عندنا هنا. هذه المصل الموجودة بالانتيريور كومبارتمنت هي السارتوريوس، إلياكس and psoas, Cutaneous and the Quadriceps femoris. Blood supply is the femoral artery and the nerve supply is through femoral nerve. صورة ثانية أكبر للmuscle of the anterior fascial compartment. These are the sartorius. هذه هي الإلياكس والسوس نسميهن إليوسوس. هذه هي البكتينيوس وهذه هي الكوادريسبس فيمورس، العضلة الرباعية. This is a cross section مقطع عرضي in the thigh, and we can see these are the muscle of the anterior compartment. قاعد نشوف هذه هي السارتوريوس، هذه هي الكوادريسبس. Quadriceps consists from 3 vastus muscle, 3 vasti, and the rectus femoris. Quadriceps muscle يعني من اسمها هي العضلة رباعية الرؤوس. هذا هو موجود عندنا الركتس femoris, and we have the vastus lateralis, vastus medialis, and the vastus intermedius in between. هاي العضلات اللي هي يعني الأربع رؤوس كلها راح تتحد عندنا نسميه بالباتيلر ليجامنت أو الكوادريسبس تندن. هذا هو الكوادريسبس تندن راح يتصل to the patella. من الباتيلا راح تكون عندنا الباتيلر ليجامنت. الباتيلر ليجامنت it will be attached to the tibial tuberosity. فراح تكون هذه العضلة هي المين extensor of the knee joint. main extensor of the knee joint يعني main action على الني joint، وعدا الركتس femoris also it have a function on the hip joint. It is a flexor of the hip joint. هذه هي الكوادريسبس tendon attached to the patella. From the patella we have the patellar ligament. Patellar ligament to be attached to the tibial tuberosity. This is the iliacus and this is the psoas muscle. We call them iliopsoas muscle. Iliopsoas muscle. We can see how the iliacus is taking origin from the iliac fossa of the ilium, and the psoas major taking origin from the lateral aspect of the lumbar vertebra, and both of them they descend down behind the inguinal ligament to be attached, inserted into the lateral trochanter of the femur. Lumbar plexus. شوف هذه هي يعني شلون أخذنا البراchial plexus بالupper limb. Lumbar plexus in the lower limb. It will give these nerves that supply skin and muscle of the lower limb. Lumbar plexus. This plexus of nerve اللي هي هنا الضفيرة الموجودة عندنا it will be formed يعني راح تتكون in the substance of the psoas major. راح تتكون في يعني داخل هاي العضلة اللي هي psoas major. From the lateral border of this muscle we have the emergence of the nerves. يعني راح تبرز الأعصاب هذه الضفيرة من lateral border of the psoas major from the anterior surface and from the medial border. اللي يهمنا هنا بهذه المحاضرة هو عندنا اللي هو الفيمورال نيرف، وراح نشوف بالتفاصيل عندنا مجموعة الأعصاب اللي أخذناها حتى يعني نقسم عندها Cutaneous Nerve. مثلا نشوف هنا هذا هو lateral Cutaneous Nerve of the thigh emerging from the branch of lumbar plexus emerging from the lateral border of the psoas major, extend across the iliac fossa, then it passes behind the medial end of the inguinal ligament, then in the thigh to supply the skin on the lateral aspect of the thigh. This is the femoral nerve, which is the thickest nerve from this plexus, emerging from the lateral side of this muscle, pass in between iliacus and psoas major, and then behind the inguinal ligament to pass in the thigh to supply cutaneous and muscular branches. هذا هو genitofemoral nerve, emerging from the anterior surface of psoas major muscle. It passes in front of on the frontal aspect of this muscle, then behind the inguinal ligament اللي هو يعني femoral branch, behind the middle of the inguinal ligament to supply a small area on the front of the thigh just below the inguinal ligament. هذه هي lumbar plexus. So what are the branches of the femoral nerve? We have the femoral nerve divided into have anterior division and posterior division. Branches from the anterior division have two cutaneous branches اللي قلنا عليها بداية المحاضرة, medial and intermediate cutaneous nerve, and two muscular branches that supply the sartorius and pectineus. From the posterior division we have one cutaneous branch that is called saphenous nerve and muscular branches to the quadriceps muscle. This is the femoral nerve, and we can see how it is passing behind the inguinal ligament here in the femoral triangle it will be divided into anterior division and posterior division. والanterior division هنا انطانا عندنا these are the cutaneous branches اللي هي medial والintermediate nerves and the branches that supply the muscle اللي قلنا sartorius والpectineus. وعندنا posterior division ينطينا saphenous nerve. saphenous nerve هذا اللي هو راح يكمل عندنا بالleg، وينطينا البرانشز اللي هي supplying the quadriceps muscle, muscular branches that supply the quadriceps muscle. Thank you.